State lawmakers have passed Governor Newsom's $215 billion budget with big moves aimed at the housing crisis and health care. It includes $2.4 billion for housing and homeless services and nearly $100 million to extend taxpayer-funded health insurance to undocumented immigrants. KPIX 5 reporter Melissa Caen has reaction from both sides.
Ayes 60, noes 15. The conference report is adopted.
And with that, the California state budget for 2019 to 2020 passed the Assembly today. It also passed in the Senate and is headed to the governor's desk. Assemblyman Phil Ting chairs the Budget Committee, and that's why people are hugging him. This budget includes an expansion of Medi-Cal to low-income people who are undocumented and under 26 years old.
There's a lot of criticism to that very small expenditure. It's only $74 million in our general fund out of the $200 billion.
Currently, undocumented people under 18 in a low-income household can get full Medi-Cal benefits, and that costs the state around $300 million a year. This year's budget adds $98 million to raise the age of full Medi-Cal benefits to 26. Ting says it's money we're already spending.
When people show up to emergency rooms in a county hospital, that's a county hospital expense. So taxpayers are already paying for people's health care, whether they're documented or undocumented, all over the state. This is a much more efficient way to go because we give them insurance, they go see a primary care doctor.
Or not. Assemblyman Jay Obernolte says that many people on Medi-Cal today can't see a doctor.
Every day, my district offices gets calls from my constituents who are unable to see a doctor, even though they are technically covered by Medi-Cal, because so few doctors in my district are able to take the low reimbursement rates that Medi-Cal provides. We had the opportunity to fix that with this budget, and we're not doing it.
The budget will also bring back penalties for people who don't get health insurance. Penalties of some $695 or 2.5% of household income, whichever is higher.
The end of the day is our goal is to try to get more Californians insured. We went from 78% insured to 92% insured with the Affordable Care Act. We're so close to being universally insured in California.
Now, the penalty for not having health insurance will actually be in a separate bill that hasn't been finalized yet. So we don't know exactly what it looks like, but Ting's office tells us that they don't know whether undocumented people with middle or high incomes who just choose not to get insurance would also be subject to those penalties. Melissa Caen, KPIX 5.